Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Hello everybody in Chicago. Hope you're keeping warm today. I'd like to welcome you to a webcast of the placement of, I think we're going to be doing 8 Lumineers today on our patient. I've been doing these now for almost 25 years. I've yet to have to give a patient a single drop of local anesthetic. That means no needles. And the only tooth structure that we ever remove is that which makes them look better. In other words, we limit our removal of tooth structure to cosmetic contouring. These have been proven to last for over 20-25 years. It isn't something recent. You don't even have to place a 0.5 millimeter margin on the tooth, and that gives it complete reversibility. So if any time a patient is dissatisfied, you can remove everything without giving them any anesthetic and put them back to the way they were. Your two most reliable surfaces that you can bond to are enamel and porcelain. We bond to them with equal ease. We just go through different surface treatment for the porcelain. One of the things we want to do is we want to be ready to go. So once I get started, this isn't going to take very long. Lisa has everything prepared here. And before you ever do your first case, I suggest that you and your staff together look at some of the DVDs on how to do this procedure. Lisa has treated these teeth with porcelain conditioner, which is citric acid, and Serenade Prime, which is a silane. So that silane gets activated by an organic acid. If you try to use an inorganic acid like phosphoric acid, it wouldn't activate the silane and then it wouldn't bond to the porcelain and you get debonding. Very simple. Remember, we're working on a patient without local anesthetic. And so I use 4-power magnification. Before I became a dentist, I was an optometrist and I wanted to be a dentist. So 4-power will give you significantly more visibility. Gordon Christensen recommends the sapphire light. He says working without the sapphire light is like working with a slow-speed handpiece instead of a high-speed handpiece. So you'll see me bond 8 Lumineers in probably less than a minute once we get started. The two most common problems that we encounter is that the Lumineers won't fit. They'll fit the model, but they won't fit the patient. And what happens is that you wonder, well, why could that happen? Probably the impression was taken out of the patient's mouth too soon, and you got distortion, and you can't see distortion. The other thing we'd recommend is that you pour the model for the first time in your office and have the patient wait while you check the margins. All too often, a case will come in to be a beautiful impression, but the definition of the gingival margin just isn't there. And had the model been poured, it'd been simple to just take another impression while the patient is still in your practice. So these are some little tips that should help you a lot. Okay, so we'll get started here. Now Lisa's already polished her teeth with the porcelain polishing paste to get rid of the plaque, and I'm going to place some paint-on dental dam on the lingual side of her teeth. The purpose of this is to prevent the ultrabond from bonding on the lingual side. One of the things you have to be careful about is not having the paint-on dental dam close your eyes. The best way to protect them is close them. Is to not have the paint-on dental dam go from the lingual to the labial. And let me give an explorer here. That's good. And this is rubbery. It's the same paint on dental dam that we use for doing chairside whitening. You'll get a chance to look at this in just a minute. Close your eyes. Close your eyes. We cure this for 3 seconds to the rubbery stage. And now you can take a look and see what that looks like. And wherever I've got the blue paint on dental dam, of course, the Ultra Bond won't stick to it. And now we're going to put etch and seal on these teeth. And I like to use the medium viscosity etch and seal because it contains aluminum oxalate. And if I get any on the dentin, the aluminum oxalate will act as a desensitizing agent, which is very helpful for your regular operative procedures if you want to etch your margins. And I just push this around, have complete control of it. Leave it on for about 20 seconds. When Bonaccord did this, he left it on for 2 minutes, and that's the way the original instructions came out, etch for 2 minutes. But we found that about 20 seconds is all we need to etch. Okay, now we'll wash this off. This takes off about 10 to 15 microns of tooth structure. Now we're going to take Tenure AB. Tenure was developed by Dr. Ray Bowen. Many people don't know his name, but he developed the composite, the high-speed air rotor, and he came to me some years ago and he said, you know, Bob, I've got this really great dentin bonding system, but he said it has 9 steps. So we put our chemists to work on it and took a license from the ADA and developed it so that it was just 2 bottles, 1 application. It's light independent, and nobody's been able to demonstrate a better clinically dentin bonding agent than Tenure. And it comes in Tenure Quick and some different configurations, but I just use Tenure AB. It's totally light independent, and it'll bond to any formulation of any composite you have, unlike some of the so-called advancements in bonding systems. They won't bond all of the different composites. Now we'll show you how we do the try-in here. Okay, left central. Now I'm putting the 1 tooth on without the shade, without the try-in paste. And then I'm going to put the right central on with the try-in paste on it. Now something happens with light. When it goes through a medium, it keeps going forward until you exceed the critical angle. Now if you take a look at the right tooth and you take a look at the left tooth, they're the same shade veneer, but they are not the same shade on the tooth, and that's what you want to capture. So what happens is when the light goes through and you have air between the etched surface of the porcelain and the tooth, it stops going forward and it reflects back the shade of the veneer with the etched porcelain on it and nothing else next to it. Now that'll change when we put another shade on here. And I'm going to remove the try-in paste off with the Tenure S. And if I don't get it all off, it will polymerize anyway because of the Tenure S. One time on my secretary, I put the Tenure S on the teeth first. Then I did the try-in. Fortunately, it was the right shade. It looked good. And we went to remove it, and they had all set. So never put the Tenure S on until after you've selected the shade and done the try-in. While I'm doing this, Lisa's putting Tenure S in the 2 that we tried on. And as I said 2 days ago, we tried them all on. Make sure they'd fit for this webcast. Lisa always gives me the name of the tooth. Left central, not the number. Okay. Right central. This is Ultrabond. It's a restorative. And you want to think about what we're doing right here. It's a combination of light cured and self cured. And why don't you give me that 2mm tip. I want to get some of these set here. Taking the 2mm tip for 1 second to spot cure these. What I'm doing is spot curing these so they won't be floating all over. Close your eyes. Before I put the 1 second cure on it, I can move it around. After I've done the 1 second cure, I'm committed. I took some 10-year-S on there and I just removed a lot of the excess, but the 10-year-S and the Ultrabond will cause it to set without the light, but we use the light and the 10-year-S so you kind of have a belt and suspenders. Now I'm using the 9mm tip for 5 seconds on each tooth. Close your eyes. And close your eyes. Close your eyes. Even though Ultrabond has a dual cured component to it, it's amine free. So that means it won't change color. And that has been clinically proven by Dental Advisor in a 2 to 3 year clinical study that's ongoing. And one of the reasons why many clinicians recommend don't use a dual cure is because it changes color. But Ultrabond has that kicker to it, and it doesn't change color. We've just bonded 8 porcelain veneers in less than 1 minute with the sapphire light. I'm not trying to go fast, but I can't see any benefit in going slower. Now we're going to remove the paint on dental dam and let you take a look at that. You see how nice the gingival tissue looks. I guess we've got them bonded, and now we're going to do finishing. And so I'll start with using this football-shaped diamond, and I'm just going to go across the lingual surface of these teeth and blend the Ultrabond, the porcelain, and the enamel together. I always use water because if you don't, you're going to get your porcelain microheated and it'll cause cracks. Remember I told you I was an optometrist? When they grind lenses for glasses, they always do it with copious amounts of water so they don't build up heat, because heat is what will cause cracking of your porcelain. So never work on it dry. Always use a copious amount of water. All of these are in the finishing kit. Nothing special about them. We just put them in one place because Dennis wanted to know what we used, and that's what I always use. Okay, now we'll take a look on the lingual side. And we've removed most of the Ultrabond, blended it. You can see that. Now we're going to take a 12-fluted burr and go around and move the Ultrabond on the labial surface. And I'll just go around the margins. This is the burr. And so I will just go all around the margins like this was a pencil in a coloring book or something like that. You're connecting the dots. And this is why magnification is so important, because I'm working right next to that gingival tissue. And I'm working right next to the dentin on the root. And I'm just taking away all the excess here. When you're watching this happen, you think this has taken a long time. But when you think about not preparing the teeth, how long would it take you to do 8 porcelain veneers for your patients in prepping, anesthetic, temporaries? We probably spent a half hour doing consultation on shade. And then we put them in after we take the shade and we do the contouring. Now these really don't look good when you try them in if you haven't prepped the teeth and created margins, because you're going to make them look good after placement. Now what I'm using is a Sure 349 instrument here to remove the ultrabond off that glazed surface. Don't use your hygienist scaling instruments because it'll scratch it. Now if you can scratch it, you can always put the glaze back with a 30 fluted burr and a dialite polishing cup and porcelain polishing paste. Okay. But you'll never scratch it with the Sure 349, so that's important to use a Sure 349 instrument with this. Now I want you to take a look at these interproximal embrasures before I start defining them. Put your head down. Okay, that's good. All right. Remember now we've created, open, a shoulder in the Serenade porcelain, and I'm going to blend that now with the tooth. And everybody else tells you not to touch the margins after you bonded it, and we say it's in the finishing when you bring these to life. And I'm just going into these interproximal embrasures. And then we'll have the patient back in 4 or 5 days and do even more finishing than we're doing today. And I'm just going up the lingual side of these embrasures so we can open the contacts. And let's assume she doesn't like having that diastema closed. See, I didn't do anything to that, but I got the ultrabond out first. If you don't get the ultrabond out first, these are really difficult. And now we'll go to the distal, and we just start sawing. And if you get to you're getting resistance, don't keep sawing with pressure, just start rocking. And then you'll get through that contact. See? And probably we'll open most of the contacts today while you're watching. Because a lot of people think, gosh, how do you get those contacts open? Well, you get the ultrabond out of there first, and then you come back in with your saw and you can separate it. And the ones you don't open today will probably open themselves when you have the patient back in 3 or 4 days. And we'll take the sander. I'm only going to open a couple of these and finish them. And I want to show you adjusting occlusion. And you probably get bored just watching me do this. Okay. There we go. Some more sander. Open. And we just take the floss through. And what we don't open up today, we open up tomorrow. And what we don't like looking at tomorrow, we can take off. So I try not to take off too much on the placement visit. Anyhow, you saw we got through those contacts. Now we're going to do the occlusion. Because shade and occlusion have caused me more grief than anything else. Open. But I don't have much grief or I wouldn't be doing this. Close. Put your chin down now. Way down. Now look at that transformation that we've done here in that short period of time. You get the translucency on the incisal edges. And we haven't retracted any gingival tissue. That's what we did for her in about an hour. Open, grind around, open. Let's see what it looks like in there. And we've got pretty good occlusion. Now here's what we're looking for. Occlusion on the tip of the cusp. Can you see that? That's good. You don't want to see a lot of pressure where the porcelain is. And so I didn't put any porcelain on the second bicuspids. And this is her natural tooth structure, And right here we got a combination. See me blow some air on that. And we built up these two laterals, and they're a combination of Ultrabond and Serenade porcelain. And I think I'll take the football-shaped diamond here. Let's take a look at the lowers. Okay, now put your teeth together on your back teeth. Close all the way back there. Now go forward. Keep going. Keep going. Okay, this is pretty good. She doesn't have too much trauma there. You hitting that left central just a little bit? Yeah. Open. What I tell my patients to do is to be careful with these. I've got one lady that likes to eat ribs, and she kind of likes to pop things off. So I told her to take up stew. But, you know, you can break natural teeth if you put too much pressure on them. So this is probably where we're going to take it today. But what we're looking for, and what you should look for when you do one of these, and I can't give everything today except demonstrate the feasibility of doing these, is the lower cuspids like to knock off the distal of the laterals. And I'm going to take a little off of that right lateral because I want to make it just a little long diamond on that. Okay. Now, if we had porcelain crowns in here, we'd be doing the same thing that we're doing when we're doing placing these on enamel. And they'll feel a little strange to you. Where you're going to feel the most strange is with your tongue, because you've been in the habit of pushing in between those spaces and they're gone now. And that takes 2 or 3 months to get used to that. Look at her facial profile now. Let's see if we get the facial, how we transformed her. Well, yeah, if you get a chance to come visit us, good. Hope you have a good meeting for the rest of the program, and look forward to seeing you around sometime. Bye.
I can't thank Dr. Ibsen enough for that, for giving, and having the power to change someone's life drastically the way that he did is unbelievable. No, I would have absolutely never gotten veneers. I'm afraid of pain. I'm such a baby, and most people are. That's probably why they don't go to the dentist. So, like I said, the pictures I've seen, the horror stories, and the fact that it's permanent, absolutely not. It's a great experience. It's really, I felt honored to just be able to, be in that chair with Dr. Ibsen and him working on me and now showing off his great idea. So, yeah, I had a blast. I did. And people I don't even know sit there and stop me and just, wow, you have a really nice smile. And I'm like, thanks. I'll tell you where to go. It's amazing. People don't even know me. And if they only had seen me before, they probably would have seen a completely different person.